Good evening, everyone. It's concerned Dr. Miskoff. It is about 8:30 p.m. on October 3rd, 2020, and another interesting day in the world. Obviously, with President Trump diagnosed with coronavirus at Walter Reed, being watched closely, and alleged, reports of him feeling quite well at this point, and he's ready to get out of there, and he's, doing work, etc. In the presidential suite there over at Walter Reed, he's getting, the best care he possibly can. Although some are arguing he may be getting VIP care, which sometimes is harmful. We know that, Dr. Sean Connolly, his personal physician, a fellow PCOM alumnus, he went to PCOM for his medical school, I believe. I did my residency there, so go PCOM, got to put one out for them. But just getting back to the questions that he was asked by the press about oxygen therapy, about imaging, about the different treatments that he's getting. A little elusive in regards to the oxygen questions, as we all saw, and also how high his fever was at one point. Did go on to say and reassure the world that he was well today, and that his pulse oximetry was 96% on room air. That's normal. That he wasn't on oxygen therapy at the time, currently, and that they were doing daily ultrasounds, and that he had a fever, but that was resolved, and he did not want to, say what the fever was. I imagine he was given some points from the Trump camp of questions not to directly answer. It seems like the oxygen question could have been done a little bit more tactfully. I mean, if President Trump did come in and was placed on oxygen, just so everybody knows, it's not uncommon for patients to get admitted and they may not need oxygen, but they're immediately, in the ER, placed on some supplemental oxygen, or when they get admitted to the floors, placed or ordered oxygen as these protocols, if you will. And then as testing is done and you watch the patient for a few hours, they're weaned off. That may have been very well what happened. Exactly when that happened is a little debatable. Was it, 24, 36 hours ago, and they're, bringing up the timeline, and was he knowingly out in public exposing people, and then went to the hospital? That's going to get cleared up, I guess, in the near future. But the oxygen question could have been handled better. He could have said something to the effect, it's not uncommon for patients to come in and get placed immediately on a 1 or 2 liters of oxygen, and as testing and possibly imaging gets done, and the patients watch for a few hours, and then they're rapidly weaned off, even if they didn't need it immediately. That's not an uncommon practice. Whether or not, nobody from the press actually asked the question, did President Trump get a CAT scan of the chest? I can't imagine the president, getting admitted to Walter Reed, extreme caution being taken, and them not doing at least one, a baseline CT of the chest, CAT scan of the chest. You can easily miss infiltrates or pneumonia on, milder cases on chest x-rays. So doing a CT on the president immediately up front, about maybe 20-25 or so percent of the public, we did CTs on. That may be off by a few percent, but it was a minority of the patients actually got CAT scans. Everybody pretty much got a chest x-ray, of course, getting admitted to the hospital. But not everybody got a CAT scan. There was issues about transporting people. Why transport them if you see it on the x-ray, and if you don't see it on the x-ray, it's milder. But if you're the president and they're trying to make decisions about treatment, the best treatment, getting a CT of the chest right off the bat to see if you have mild, vague. Remember, we talked about this in the early vlogs. Those basilar, lower lobe, peripheral opacities and viral pneumonia that COVID caused and causes, and probably a component of ischemic or blood clotting at the micro level happening distally or out towards the edges or periphery of the lungs. So it would be helpful to know, especially if he was hypoxic or his pulse oximetry was not normal initially. A lot of these patients didn't feel much, and when they walked across the room, now you can get on Amazon a pulse oximetry at home in 24 hours or 48 hours. Everybody can do a pulse ox. The new Apple watches can check pulse ox. So it's accessible, and a lot of patients came in saying, I didn't really feel that short of breath, but I was recording pulse oximetries in the low 90s or even 80s, and not necessarily feeling it. That was a bit unusual in regards to COVID. So it makes sense that they gave him remdesivir today. That has been studied for mild to moderate and severe. It's being studied, continuously studied, and although it hasn't shown a death rate or mortality benefit yet, it has shown a shortening of the course of the illness. I saw one remdesivir reaction which was mild and reversible with the holding of the drug. It's a 5 to 10 day course, 5 days if they're milder, 10 days often if they're more severe. You have the option of extending the 5 day course to 10. That's why he's not going home right now. And also remember, we talked and we know from experience now that if the cytokine storm and the opacities, the pneumonia is going to progress, that 1 week mark, that 7, 8 day from symptoms is classically when we did see it and are seeing it. Excuse me. And then, up to about 10 days, maybe 12 in some rare cases, we did see resurgence of fever. It resolved and then come back, although a lot of the patients who stayed resolved and got better. That was more likely to happen, but we did see some people pop fevers days after not having it as infiltrates or opacities, abnormalities on chest x-ray. And I guess Walter Reed's case, they said they do daily ultrasounds. Daily ultrasounds is great. You save the patient radiation from the x-ray, but the x-ray is really not that big of a deal in radiation when you're acutely ill. To get a few x-rays is not going to cause you harm. Remember, a CAT scan is about 50 to 100 x-rays in radiation, depending on what type of protocol you're using. You're doing thinner cut CAT scans with higher resolution, it's going to be closer to 100 or so. And if you're just doing a quick CT, then that may be closer to about 50. So doing a daily x-ray on the president would make sense. I mean, why skimp on that regards? Ultrasound is fine. It's been studied. It can be as good as a chest x-ray in noting changes in these, in a pneumonia that's progressing, especially one that's densely consolidated that you could pick up on ultrasound. But if you're the president admitted to one of the best hospitals in the world, I would imagine he's going to get an x-ray at some point prior to discharge, and I can't imagine them putting him in there and not doing at least a baseline CT. My instinct is that he probably went briefly on oxygen. A CAT scan was done and showed some minimal stuff. Remdesivir, multiple people were chiming in about remdesivir. It does have authorization to be used now. It's been studied. Does shorten course. I saw one reaction, like I said, mild, reversible, and we saw liver functions go up and sometimes kidney failure, but it was usually mild, reversible, and didn't seem to be a cause of death at least. It's all anecdote. We'll see what the true studies show, but yeah, I think the remdesivir was a no-brainer, especially if he had the other fight. Now, if he was truly just mild and didn't need any oxygen and had no infiltrates or pneumonia on CAT scan, and his fever was mild and resolved and broke, he would be like his wife, Melania, which is probably what happened, and I don't even think they would have given him the antibodies. So something was brewing. Somebody saw something and had that insight to give therapy. The antibodies, they're making us think about it. It was dangerous if something bad happens, and that's true. But there is a lot of experience with antibodies, monoclonal antibodies. This is a polyclonal, giving more than one antibody. But in general, our experience, at least in the asthma world, as I said last night on the vlog, rheumatology, chemotherapy, hemonc, hematology oncologist, most of these antibodies, when they're designed this way, do not have severe side effects, although it can happen, of course, on rare occasion, and there was a risk in doing it. I think the remdesivir was a no-brainer. The antibody was curious to me that they pulled right the Regeneron for that. Obviously with the preliminary data on that 200 plus patients from Regeneron on the antibody pool, not showing significant safety concern and looking to show efficacy. Again, no mortality data on that at this point. The supplements, I think, were a good idea, no-brainer. We mentioned maybe adding vitamin C. Decadron, nobody's talking about it too much. It's trying to get asked at the very last question in the press conference as Conley left the stage. Was the president given Decadron? And he just kept walking. Interesting. Decadron, I've made comment that I think as an outpatient drug, it may have utility. Most docs probably wouldn't agree with that, although I don't want to speak for others, because, it does suppress the immune system. They say in viruses, you want an immune system intact up front. I've done a vlog on low-dose naltrexone. That's being looked at for potential clinical trial. That has almost zero side effects at the dose that we've referred to, 3 to 4.5 milligrams HS. Conley didn't pull that one out. I'm guessing he doesn't know too much about it, but I would absolutely give the president that. Even though it hasn't been studied for COVID yet, or I guess it's being planned potentially, it has been FDA approved at 10 times the dose I'm talking about for heroin addiction classically, and FDA approved for that with safety and efficacy. and passing safety at 50 milligrams plus. I'm talking 3 to 4.5 milligrams. That wasn't pulled out. Um, uh, Nobody asked the direct question about, was a CAT scan actually done on the president? I'm surprised somebody didn't think to ask that. I'm not sure he would have answered it. And did the CAT scan show abnormalities or opacities? I think would have been a great question. Back to the supplements again. Vitamin C they weren't giving. They did mention D. They did mention zinc. They mentioned aspirin. I think most of us, if somebody was hospitalized in the D dimer, they never got to the actual D dimer levels. He didn't. I don't think he was asked that directly, or I missed it. But it would have been nice to know what was his D dimer level. He wouldn't have answered it, I think, if he wouldn't answer the temperature question. But was his D dimer checked and abnormal? Would have been a reasonable question. And why aspirin, not a more powerful anticoagulant? If you're pulling out antibodies, you're pulling out remdesivir. Why not pull out that question? And then other antioxidants, I mentioned glutathione, although not the best absorbed agent. Some are given N-acetylcysteine as a oral agent. You can also nebulize that. And I've mentioned bromelain as well. These are all soft drugs, but when you're giving remdesivir and antibodies and stuff that may tickle or get the liver or kidneys upset, maybe adding too many supplements could be of issue. But I think at the doses that they're giving this stuff and what we know about these supplements, there's probably very little risk at all, and maybe some benefit. And of course, melatonin he's on too. So you're sort of getting an almost holistic approach mixed with an unknown approach mixed with remdesivir, and it's an interesting cocktail. I think the president is going to do well, in my opinion. But we have to get to day 7, 8 from symptoms, and I think that timeline is still being pinpointed exactly. So if I was his physician, I would say, look, you got a presidential suite there. I'm thinking a few thousand square feet. He's comfortable. He can do all the work he actually needs to do except travel, but he's not traveling for 14 days anyway. You're observing him for a 5 to 10 day period for the remdesivir. If he develops hypoxia, progressive infiltrates, a recurrent fever, then they'll probably go the 10 days on the remdesivir, so then he's in for 10. Although you could infuse the president with remdesivir in the White House easily. I think they want the monitoring, and I think they want the team approach, as you heard, multidisciplinary approach from our fellow pulmonary critical care colleagues there at Walter Reed. I think that's it for tonight. We didn't talk about Pepsid, but that was thrown in for his prophylaxis. I mentioned it last night. Whether he's getting just 20 milligrams daily or BID or a high dose IV like Northwell, I guess hopefully somebody will tell us what the exact regimen was once the president has recovered. Wish him a speedy recovery. I wish everybody a speedy recovery with COVID, and everybody stay well and take care of themselves. Have a great night.